What is one thing that every single doctor should be talking about, but yet very few pediatricians and family medical doctors know hardly anything about? The vagus nerve, and how vagus nerve dysfunction and disorders are serious contributors to all sorts of neurological challenges in kids today. The science is clear, and there is more research coming out every year linking vagus nerve disorders and dysfunction to all of the common neurological disorders in kids, such as autism, ADHD, anxiety, sensory processing disorder, and especially seizures and epilepsy. This video is for parents who are still searching for answers to explain their child's neurological conditions and haven't yet gotten a full understanding of what's really going on from their pediatrician, neurologist, and traditional care providers. It's also for you if you've done all sorts of research into the role of gut health in neurological disorders, know about the gut-brain or brain-gut connection and the vagus nerve already, but want to learn more. In this video, you'll learn all about vagus nerve disorders and how they link to everything from autism, anxiety, sensory challenges, and ADHD to seizures, dysautonomia, POTS, pandas, and more. Let me tell you a story about Bella. Bella's was having seizures every night. Well, maybe not every night, but a lot of nights at bedtime. And her parents were terrified that she was going to keep having these seizures. They had tried going to a neurologist, but didn't feel comfortable having their child labeled with a forever diagnosis or just putting her on medications that had terrible side effects and just leaving it at that. Dad said this wasn't going to be what we settled with. So they kept asking more questions and searching. They wanted a doctor who was on the same page as them and looked at their child with the healing and potential they knew she was capable of. And that's when they were told about neurologically focused pediatric chiropractic. With a completely different approach to helping seizures by assessing the stress and dysregulation in the nervous system, they felt it was like a breath of fresh air and felt so much more hope. Here's what Dad has to say. When we were first shown our daughter's scan and they explained to us what all of that meant, we were shocked. Honestly, we were sad to see what was happening to our baby girl's nervous system all this time. But we were also happy because now we had a target to smash. And let me tell you, the PX docs started smashing that target so efficiently, so effectively. Wow. From day one, Bella started sleeping better and wasn't waking up during the night. She overall had a much calmer attitude, but the biggest celebration is this. Bella is now seizure-free and is absolutely thriving. She has not had a seizure since day one of starting care, and she continues to get adjusted to take on life like a boss. Way to go, Bella. So if there was just one thing we wish we could teach all parents, it's this. The connection between birth interventions and trauma and early exposure to toxins in kids and what are called vagus nerve disorders and dysfunctions. The vagus nerve is by far and away the single most important nerve in the entire body, serving to control and regulate core developmental and health function in kids, such as sleeping, eating, digestion, immune function, speech and communication, socialization, behavior, and emotional regulation. When this one thing goes wrong and the vagus nerve is not working right, it opens the door for a myriad or perfect storm of neurological challenges in particular. Vagus nerve disorders and dysfunction are strongly linked to common neurological challenges in kids, such as autism, ADHD, sensory processing disorder, anxiety, and epilepsy or seizures, as well as two conditions that are dramatically on the rise in teenagers, especially POTS and pandas. Here's how vagus nerve disorders and dysfunctions are linked. First, the vagus nerve is often injured or damaged via birth interventions and trauma from things like forceps, vacuum extraction, induction, and C-section. That's because the vagus nerve starts in your brain, and then it comes down through your neck, goes all the way into your torso, affecting your heart, your lungs, your digestion, and everything that's up in here, affecting the parasympathetic system. So second, the vagus nerve is very sensitive to early exposure to toxins, antibiotics, and overuse of other medications. Vagus nerve disorders and dysfunction, known as subluxation, first shows up as things like colic, constipation, and ear infections in infants, and parents are mistakenly told, don't worry about it, it'll go away. They'll grow out of it. Then from there, they progress into neurodevelopmental delays and motor challenges, such as missed milestones, delays in walking and talking, frequent tantrums and meltdowns, and other emotional or behavioral problems in toddlers and preschool-age children. And finally, from there, with the vagus nerve not working properly to calm, balance, and regulate that side of the nervous system, grade school kids and teenagers end up with a sympathetic nervous system that is stuck in constant overdrive and fight or flight, contributing to challenges with hyperactivity, impulsiveness, paying attention, behavior, anxiety, and more. For many kids, if the vagus nerve disorder and dysfunction is there long enough and severe enough, they even contribute to really challenging conditions such as seizures, epilepsy, POTS, and PANDAS, all of which are conditions that are deeply rooted in neurological dysfunction and very much need advanced neurologically focused care like we provide here at Generations Chiropractic. Thankfully, the function of the vagus nerve can be measured and assessed in just 3 to 5 minutes in our office with an incredible piece of technology that is truly now on the forefront of all of healthcare, called the HRV, or heart rate variability. This is an example of what heart rate variability looks like in our office and how we measure it, where we can see how things start, where that dot is, and how it can progress through care. This exam tells us in just minutes if your child is struggling with vagus nerve disorders and dysfunction, and if so, how severely. Once we have this incredible HRV and our other neurological exams that look for vagus nerve disorders and dysfunction, we can then put together a very customized and personalized care plan with your child in mind to address these challenges head on without drugs or surgery. So, if you have any questions, please leave a comment below or send us a DM. Please share with other parents, family members, Facebook groups who need to hear this, and give us a call and come get checked if you need to.